In this video, we'll be talking about lung anatomy. This would be the first video in a series of videos which will be addressing lung anatomy, physiology, as well as respiratory mechanics. Well, the first question to answer is what are the functions of the lung? Well, the lung has several functions, but the two main functions are to provide ventilation and perfusion. That's to say, to deliver oxygen and remove carbon dioxide. And the second function is to help with the innate immunity in the defense against airborne pathogens. Some other less recognized functions include surfactant synthesis, helping with mucociliary clearance, as well as neuroendocrine signaling, which helps control the lung's immune response. Here are some fun facts about the lung. The lung weighs around 900 to 1,000 grams. 40 to 50% of that is actually blood. At maximal inspiration, the lung can contain up to 6 liters of air, and at maximal expiration, the air left in the lung is around 2.5 liters. The trachea, which is the large midline airway in the respiratory system, is around 10 to 14 centimeters in length. It's composed of 16 to 20 trachea rings. The trachea rings have a C-shaped configuration, with cartilage being present only on the anterior and lateral portions of the trachea. The trachea divides into the right mainstem bronchus and left mainstem bronchus at the level of the T5 vertebra. This is also the level of the sternal notch. The trachea could also be divided into an intrathoracic portion, which constitutes around 2/3 of the trachea, and an extrathoracic portion, which is around 1/3 of the trachea. As far as the diameter of the trachea, it ranges between 13 and 25 millimeter between one patient and the other, depending on their age, gender, and height. The trachea divides into several bronchi and then eventually ends in terminal bronchioles, respiratory bronchioles, and last but not least, alveoli. The distal portion of the airway, that's to say, the terminal bronchioles, the respiratory bronchioles, and the alveoli, contain no cartilage. That's opposed to the bronchi and the main trachea. The respiratory bronchioles and the alveoli are the main two locations where gas exchange occurs. The respiratory system has two types of circulation. The first one is the bronchial circulation, which supplies the majority of the respiratory system, including the trachea, the main bronchi, the pulmonary vessels, and the visceral pleura. This constitutes around 0.5 to 1.5% of the cardiac output. The second type of circulation is the pulmonary circulation. This comes directly from the right ventricle. That's to say that the flow through the pulmonary circulation equals the cardiac output, and this feeds the alveoli, which will allow for gas exchange. The branches of the right and left main bronchi are not exactly identical, with the right main stem bronchus more parallel to the trachea at around 25 to 30-degree angle, while the left main stem bronchus is at around 45-degree angles from the trachea. The right lung is divided into three lobes, each lobe containing several segments, totaling 10 segments in total, while the left lung has two lobes with a total of 8 to 9 segments, depending on whether the apical posterior is considered one segment or two segments. It's worthwhile knowing that the cross-sectional area of the airway increases the further out you go in the airway, being the smallest at the trachea and main bronchi and the largest at the level of the terminal bronchioles. This means that most of the airway resistance is in the upper airway and bronchi. This has multiple implications on respiratory physiology as well as respiratory mechanics that we will discuss in future videos. The pleural space is that potential space between the outside of the lung and the inside of the chest wall. That space is lined by a thin layer of tissue called the pleura. The part of the pleura lining the chest wall is named the parietal pleura, while the other part of the pleura that is lining the lung is named the visceral pleura. The pleura is composed of a thin single layer of cells called the mesothelium. This is identical in the visceral pleura, parietal pleura, as well as the peritoneum and pericardium. The mesothelium is highly metabolically active and covered in surface microvilli. It's interesting to note that the only mammal that does not have a pleural space is the elephant, and I'm hoping that we'll talk about why that is the case in a future video as well. There is a very tiny amount of fluid that's poured into the space on a daily basis. That fluid is around zero point 0.3 cc's per kg body weight, and it's caused by filtration via hydrostatic oncotic pressure gradient. It comes mainly from the intercostal arteries of the parietal pleura, as well as the bronchial circulation. The total amount of fluid that is poured into the pleural space on a daily basis is around 17 cc's. That fluid is drained via the parietal pleural lymphatics with a drainage capacity of 1 to 2 liters per day, which is several fold the amount of pleural fluid being produced on a daily basis. Pleural fluid can accumulate in the pleural space when the amount of fluid produced is much higher than the amount of pleural fluid being drained. This is akin to a sink where the amount of fluid poured into the sink is much higher than the amount of fluid drained from the sink. The production of fluid can increase from several causes. For example, in cases of CHF and ARDS, you have mesothelial junctional damage, which leads to alveolar and interstitial fluid to move from the interstitium into the pleural space. As the drainage through the parietal pleura is typically much higher than the amount of fluid being produced, there's typically a concomitant lymphatic obstruction which leads to development of the pleural effusion. If you like the content of these videos and would like to see more of these, please take a moment to like the video, subscribe to the channel, and share the video with your friends.